I'm going to take a few minutes to tell you about advocacy, why it's important, how the coalition helps you, and what it takes to be effective. As the advocacy arm for our field, the Coalition for Health Services Research is almost the only group communicating regularly with stakeholders both on and off Capitol Hill for what we do. What does advocacy mean? The Coalition commits all its resources to support efforts that are of greatest interest and benefit to you, specifically educating policymakers about the issues that matter most to you, seeking increased funding for investigator-initiated research, seeking training grants, advocating the value of comparative effectiveness research, and encouraging public health system research, just to name a few. Despite the amazing recent changes in health policy, advocacy is still vital to the success and growth of our field. The President has asked all federal agencies to cut budgets by 5%, and the Congress is increasingly not interested in increased spending either. Thus, the Coalition will be critical in the future to hold recent gains and to help you achieve your objectives. How has the Coalition helped you? We've seen remarkable success in recent years. In just a few minutes, I'll present an award to one of our own health services researchers for his work on the use of checklists to further patient safety. In keeping with the checklist notion, I have a Coalition for Health Services research checklist. Number 1. Secure for the Agency for Healthcare Research and Quality and the National Center for Health Statistics significant and sustained funding increases, 25% and 27% respectively. Check. This funding has allowed these agencies to restore and expand survey sample sizes, rebuild investigator-initiated research grants, and offer more training opportunities for the next generation of health services researchers. Number 2, this is a good one, David. Secure $1.1 billion for comparative effectiveness research through the American Recovery and Reinvestment Act. Check. In a related effort, we also helped to secure a new mandatory funding stream for comparative effectiveness research through the Affordable Care Act. Comparative effectiveness research will be more broadly known now as patient-centered outcomes research. Mandatory funding means that money is guaranteed to flow every year as opposed to discretionary funding that is appropriated annually at the whim of the Congress. Now, to paraphrase the way they talk in Washington, this is a big freaking deal. In this connection, we have a responsibility to make it work. And I wanted to issue a warning about the use of patient-level data as we conduct our research. With our growing access to electronic medical records, we must redouble our efforts to protect this data and follow institutional review board procedures, no matter how bureaucratic and inefficient they may be, and their directives. Protect this data. Don't put it on your laptop. This data has the potential of being, this concern has the potential of being the field's equivalent of a BP oil spill. We must know the rules and follow them for handling patient-level data. A future Tony Hayward should not be in this room. On the checklist, number 3, help policymakers see the value of investigator-initiated research grants in our field in the same way R01s are valued in clinical and biomedical research. Check. After years of education, appropriators now make funding for these grants a priority in their spending bills, going so far as to direct funding in ARC's budget for these grants, $23 million in 2010. Number 4, work to secure funding for new and emerging disciplines of our field. Check. In the same way we led efforts to secure funding for ARC's comparative effectiveness research program, when first authorized in 2003. The coalition is collaborating with other national public organizations to secure $50 million for the new Public Health Services and Systems Research Program authorized in the Affordable Care Act. And number 5, protect researchers' rights to publish their research. This gets a great big check with a gold star. The coalition worked to strike language from the Senate's health reform legislation that would have restricted the publication of research findings generated under a contract with the new Patient-Centered Outcomes Research Institute. If the coalition had not been successful in this language would have remained in the Senate's bill, which, as you know, eventually became the law. So what does it take to be effective? The coalition checklist would not be this complete without a dedicated staff in Washington working on your behalf every day. And first and foremost is David Helms, who has worked for 10 years on this effort, and I'll tell you, it just doesn't happen in 1 year. The relationships and the connections are so important. So special thanks to David for his tirelessness and working effectively for the checklist I just covered. The coalition also has a board that includes experienced bipartisan policy and research professionals who understand both the issues of our field and how to get things done in Washington, including the budget process. The board provides the coalition staff strategic direction and facilitates relationships on both sides of the aisle. This last point is very important. As researchers and policy wonks, which is no spelled backward, as you know, we absolutely must retain the historic nonpartisan and bipartisan makeup of Academy Health and the coalition on the staff, the boards and its advisory groups. We labor in a political environment, and the need to maintain our connections in all sides of the aisle is important. This will also advance our reputation as scientists and dispassionate analysts of healthcare policy. The coalition and Academy Health boards have and will continue to work together closely as we seek to influence the implementation of health reform and all the regulations that affect our field by monitoring those regulations and submitting comments on your behalf when appropriate. The coalition requires resources to do this work. The support provided by Academy Health members and our organizational affiliates is vital to our success in increasing funding. If the economy remains weak and the attitude toward federal spending erodes, the coalition will need your support more than ever. We will need both your financial support through your Academy Health membership and your voice as we serve as the evaluators and experts for implementing health care reform. We will call upon you to contact your elected officials, write letters and emails, and urge continued support for health services research. Such grassroots efforts during the Recovery Act debate were critical in sustaining comparative effectiveness research funding in the bill. We certainly know that when elected officials hear from their constituents, they listen. So I encourage you to develop a relationship with your members of Congress, as I have with mine. Visit them in their district office back home or attend a town hall meeting. During these visits, let them know why health services research is important and how it can help them make better decisions. Thank you for your support of the Coalition for Health Services Research.